Thank you so much. Thank you for attending the webinar this afternoon. I noticed that we have about 28 people, so I am going to present to you my master capstone project about the effectiveness of guideline implementation strategy in community health practice. Just like you need equipment and knowledge to fly a kite, and you see that in the stream that it's all the kite equipment, we also need relevant strategies and also knowledge to implement clinical practice guidelines. To begin with, today's adventure, next slide. Oh.
So May, you can actually advance them if you just want to use the arrow up at the top.
Yes, I'm trying. Oh,
yep,
there you go. So today's, I would like to invite you for an adventure to fly a kite with me in my garden. There are a few steps for us to walk up to this garden, such as knowing the background, knowing the purpose and objective of this kite, and what kind of framework I am using for this kite, and how did I design the kite and fly it, and then we can fly the kite together in a group activity. But before I go on, I would very much like you to tell me where you're coming from. I am, as you know, I am from public health, so I would like you to actually send me a note where you practice in nursing. So in the chat box, just put down where you're coming from. So just put down where you're coming from in the chat box. Where are you coming from? Oh, great. Got a couple home cares. Lovely. Public health, family health. Oh, we have a acute hospital, Accreditation Canada. Awesome. Oh, we even have telehealth care. Great. Great. Clinical instructor. Ooh, more public health. Yay. Thank you so much. We have a variety of, even CCAC floor in the hospital. Thank you very much. So, let me go on. So, before we do that, we want to ask you to give you a little bit background of my kite. I want to tell you what is my kite, why is this kite so important, where this kite is flying, and who is flying the kite. As you know, what is the kite? The clinical practice guidelines have emerged in recent years to be promising to provide direction in translating best available evidence in practice. The National Guideline Clearinghouse currently listed more than 2,000 guidelines on its website. However, it is still unclear which type of strategies and processes are most effective in what practice setting when attempting to implement these guidelines. As a best practice spotlight organization coordinator at Toronto Public Health, my job is to collaborate with numerous interdisciplinary teams to implement and evaluate many many RNAO best practice guidelines. I heard someone can't hear me. Can you hear me now? Great. So we are currently in Toronto Public Health implementing 10 best practice guidelines. Why is this kite important? This project is important because the audience said that, Heather said that it sounds like I'm on a train. I think it's better to mute the background, to mute everybody.
So I think if somebody is joining as a group, if you're on speakerphone, you just press the mute button on your telephone. If anybody has that mute button on their telephone, unfortunately the teleconference line isn't allowing me to mute everybody without them being able to unmute themselves. So if you have a mute button on your phone, could you please just make sure that that's pressed?
Okay, so I can continue. Okay, so I'm going to go back to why is this kite important. Better. This project is important because successful approach of guideline implementation can improve client health outcome, reduce variation and cost in health care, make efficient and timely decision, and contribute to excellence in quality care, and lastly, ensure sustainable evidence-based practice. Now, where I'm going to fly this kite? Well, because I work in the community health setting, which is public health, so I am interested in flying this kite in this setting. So my garden that you are inviting to join is a community health garden. So who is flying the kite? Well, there are many key stakeholders that are interested in this kite. In particular, the best practice spotlight organization steering committee and the 10 BPG team in my organization. And of course, other best practice spotlight organizations that are also implementing the RNAO best practice guideline. And this is why I am presenting to you today. Well, another one is, how is the kite flying so far? Well, in my organization, the use of champion is the main strategy chosen to implement these guidelines. So I am interested in exploring other effective and relevant strategies and processes to implement clinical best practice guidelines. Well, the purpose of today is to explore and describe strategy and processes used by health professionals in community health settings to effectively implement the best practice guidelines. And there are 3 objectives for today. Number 1 is to describe the type of guideline implementation strategy used in community health settings. Number 2 is to understand how these strategies are applied. And number 3, to identify ways to use these strategies and processes in your setting.
Just to let you guys know. Okay.
Okay, so in order to explore a successful and effective implementation strategies for clinical practice guidelines, we require a framework to guide evidence synthesis and provision of an implementation process. I am using one of the models called the Joanna Briggs Model, Institute Model, and this model is believes that robust evidence is generated through 4 elements. As you see on the right-hand side, FAME, FAME. So F means feasibility, A means appropriateness, M means meaningfulness, and finally, E means effectiveness. Joanna Briggs Institute also believes that evidence needs to be effectively and appropriately meet the needs in ways that are feasible and meaningful to the practice setting and key stakeholders. JBI also considers systematic review as the core approach to evidence synthesis. However, the JBI model does not explain the process of guideline implementation. So hence, I'm going to use the KTI model, which is called the Knowledge to Action Framework, to complement the JBI model. So that's my next slide. The KTA model, the Knowledge to Action Framework cycle, is a process theory that I can incorporate to implement this project. The cycle has three phases of the knowledge creation cycle and 7 action phases. And the framework is also used in the best practice guideline toolkit by the RNAO. I use the stage 1, which is in the red circle. Stage 1 is called the action cycle is called the problem or gap identification. Then in this project, the problem is to find out the effective strategy and processes for guideline implementation. So once the problem is identified, then I go back to the inverted funnel, to the blue circle. That is called a knowledge synthesis cycle, and systematically examining the literature. The KTI model also believes, just like the JBI model, believes to use a systematic review methodology for evidence synthesis. After the evidence has been synthesized into a concise format and provide recommendation to the key stakeholder, that's the tip of the triangle, the inverted triangle. That's where the essence of the literature synthesis. So after that, then the uptake of the product will depend on adapting or tailoring it into different practice contexts. That's going to be back to the green circle, adapting knowledge to local context. Next, I'm going to actually show you the stages of knowledge synthesis that I use. I adapted a knowledge synthesis process developed by Pope, May, and Popey, which consists of establishing a systematic review protocol. That's number one step. Then develop a comprehensive strategy to identify studies using multiple database. That's the second step. Then I use my own data extraction matrix adapted by Garand to collect all relevant data of the included study. The third step. The fourth step is I use the appraisal tool from MSTAR. It's a measurement tool for the assessment of multiple systematic review. Critical appraisal skill program, which is called CASP in short, from England, to appraise relevant qualitative and quantitative articles. I also use the mixed method appraisal tool developed by the McGill University to assess any mixed method articles. After that, I use a narrative synthesis approach to analyze the data. And to ensure rigorous of the review, I try this process ahead by completed a preliminary synthesis of 5 selected articles. Then I interpret these findings and how they apply to the practice context. I developed a recommendation plan and then present it to the key stakeholder like you.
Did I not mark it? I'm sorry.
Rich is my best practice.
She's gone.
Sorry, somebody's not on mute right now, so if you could please mute your lines. We're hearing some speaking in the background. Thank you. Sorry, May.
Thank you. That's okay. So I presented finally the step is dissemination. I developed a recommendation plan and presented to the key stakeholder, which is one of them is my best practice steering committee in June. Then I also developed a plan to disseminate the findings, and this is the first event for me to disseminate the finding, and my next one will be in October to my senior management team. So to ensure transparency and reproductivity of the steps, I drew a Prisma flow diagram to capture the path of the search process. I screened over 2,500 studies. It's actually 2,869 from 5 databases from 2008 to 2015, and hand searched 2 journals from 2008 to 2015. Then, which is the next slide, then for the full text screening stage, I actually screened 45 articles, and from the 45 articles, I excluded about 21 articles, and finally resulting 24 articles was included in my study and analyzed them. So this is the best part of the presentation. There is about a total of 9 different single strategy and 25 combined strategy were used for guideline implementation in the community health setting. Of these single strategy, 8 were applied in the primary care setting and 1 in a community health center. Of the multiple strategy, 19 of them were used in primary care setting, 11 in public health, 7 in management child health agency, 3 in an occupational therapist and physiotherapist clinics, and also 1 in home care setting. And 2 of them are also in community health center. There was one specific strategy. There was not one specific strategy that would clearly identify as feasible, appropriate, meaningful, and effective for the guideline implementation, since the characteristics of the strategy were seldom discussed in the included study. But the number of the strategy were effectively used, as well as whether the multiple strategy are likely more effective than single one remain inconclusive. So here I selected 10 strategies for this webinar. Of course, the first one is one of my favorites, set up a group of champions. There's 2 studies actually use champion as an implementation strategy. One of them used champion to support and facilitate guideline implementation.
Acknowledge that we were here.
Yes. Yes. So in the second study, the champion provided expertise in breastfeeding knowledge for a planning committee, and as a result, nurses are more knowledgeable and confident in providing breastfeeding information to clients. Second one of the study is training strategy, is training workshop. Evidence proves that educational training is most effective when they are interactive and engaging to the audience. Reminder systems is the third one. In one of the studies, the organization actually built in a reminder system in their electronic system to remind staff to document. I find that is really interesting. Audit and feedback. That is actually including chart auditing and providing performance feedback. Therapeutic framework. This is really interesting to me because I find that there is 3 of them that uses theory. Particularly one of them uses the follow the knowledge to action framework by Graham to implement the guideline. Educational material and supply, providing that to the staff so that it will be easier for them to implement the guideline. Guideline adaptations. There are a few articles have to adapt the guideline recommendation before using it, and I actually have the privilege to actually using that. A lot of RNAO BPGs, we usually have to adapt the guidelines into public health practice before we actually implement it. Information to stakeholders. There is actually articles about distributing supply to clients, to staff, and also to group populations. The last second one is educational outreach. That is going to different teams for training and even asking them how the implementation is going. It happened also in my organization. When we implement the smoking cessation guideline, we actually developed a policy, a tobacco use cessation practice policy. So what we do is we actually went to the champion went to different teams to train them for the policy, to train them for the best practice guideline, and also as well as to train them how to document in our electronic data, and then conversely how to actually document to the inquiry system. Last one, again, is the structured record, developing a structured documentation tool for charting, whether it is in an electronic system or paper system. We did that in Toronto Public Health to develop a structured documentation tool for smoking cessation policy, and as well as paper system, because some of our directors still using paper to document. So we were using both of them to give us information for the inquiry, so we can actually put that in the inquiry system. three most frequent use strategy that I noticed from the literature is educational meeting, educational material, and also educational outreach. But of course, I said the strategy that I find most interesting is that the study that followed a theoretical framework for guideline implementation and evaluation. Next one is the process. What kind of process in the literature are using? I use PROCESS, the process, to actually let you know some of the process that the literature are using. So P is representing practice support and facilitations. It is crucial to have a full-time person facilitating this process. R means, remember, practice context is very important. So when strategy used in one program area or a unit, it may not work in another unit, so you need to reassess the context again. O is organization readiness and support. It is important to get senior leadership support. C is collaboration and partnership. Collaboration with other interprofessionals within the program, partner with different organizations, example, academia or other community health agency is crucial. In Toronto Public Health, when we implement a field guidelines, we actually increase a collaboration between the 2 or 3 directorates, and it was all because of implementing the best practice guideline. And E is embedded knowledge into practice, whether into the training material, in the service area, in the documentation system. One of the guidelines that we're implementing is the postpartum depression guideline, that we actually embedded the implementation strategy right in the service area, so the staff from the maternal infant health or implementing the recommendation from the guidelines. S is the stakeholder ownership, and I think that is the most important process, that the staff or the client need to own the project, the best practice project. So involving them and seeking them for feedback is crucial. And of course, S is setting up a central planning committee. So in summary of the process, the strategies can only be applied to the organization when it is ready to commit to implementing the guideline. Organization commitment exists when there are sufficient resources, as well as management and expert support provided to staff. A central planning committee is set up, consists of relevant stakeholders who possess the same vision and willing to take ownership at all levels of the implementation process. A designated person to facilitating the process is crucial, because he or she can work with the stakeholder to tailor and select appropriate strategies and provide support as the key to monitor a successful implementation. And finally, a systematic quality improvement mechanism is vital to sustain the change and to integrate new knowledge into practice. So I look at all these evidence, and I actually make a recommendation to my steering committee. And a plan was developed based on these findings and under 4 broad themes. Number 1 is piloting relevant implementation strategy. Support is the second theme. The third one is partnership. And last one is the use of a framework. So I recommended my steering committees to pilot a research study on relevant implementation strategies in a best practice guideline. I would like to brainstorm with champion for appropriate strategy used in their practice context, explore the strategies to engage the champion, maybe actually to use a webinar to present this presentation to them first, and then evaluate the number of relevant strategies required for guideline implementations, and evaluate this strategy used in terms of feasibility, appropriateness, meaningfulness, and effectiveness in a BPG. Support. I recommended the steering committee to obtain support from management. KTH is planning to have a senior management visit in October, providing them an update to the spread of the best practice project, increase collaboration between the directorates for the best practice work, obtain support from the directors for champion work, and increase their understanding of BPSO and guideline implementation and evidence process. The third one is increase partnership with other stakeholders, example, academia and students. KTH has developed a proposal on how to involve undergrad students in the best practice work. Toronto Public Health wants to engage appropriate academia and community agency in guideline implementation. We want to create a community of practice in the best practice BPSO work for public health unit, and internally we already have a community health practice for the tobacco use cessation practice, best practice guideline. Finally, I recommend them to use a theoretical framework to guide the best practice work. Example, using the Knowledge to Action framework or the National Collaboration Center for Method and Tool Evidence-Informed Public Health Decision-Making Wheel to guide implementation and evaluation of the best practice guideline. So now it's your turn. Now I'd like to invite you to engage me in a group activity, Flying the Kite with me. Based on what you know from the evidence about effective guideline implementation strategy and the process that I just mentioned, name an evidence-based strategy or process that you heard from this presentation to apply in your organization. You can also think of other strategy and process that you have done and was successful in your organization. So as you see, the hashtag effective practice change, well, the reason why I'm using that is I'm promoting using social media. So just pretend that you're actually tweeting me. So I'm going to write it on the chat box. Hashtag effective practice change, and you're going to give me an answer. There you go. So I invite you to actually give me name an evidence-based strategy or process that you have heard from the presentation or your own that work very well in your organization. Staff engagement. Anybody else? Oh, good. Staff engagement, health education, leadership support, ability of using champions, organization support for policy development. Excellent, excellent. These are great strategies. In service, yes. Like training. Anybody try to use a theoretical framework? Oh, I like someone said BPSO coordinator full-time. Yay, yay, yay. Yippee, this is great. Logic model. Oh, my friend will love you. Tina Sahey, she and I are actually writing a paper on using the logic model for best practice guideline practice. Champion staff feedback. Excellent, excellent. So finally, I thank you for you to enter my garden and fly the kite with me today. At this time, I would like to acknowledge and thank my professor at the Trinity Western University, Dr. Barbara Esther, Dr. Rick Sawatsky, Dr. Sherry Reimer Kirkham, and Dr. Maggie Sorum for their ongoing support and continuous encouragement and guidance in completing this capstone project, this thesis, and my master program. Also, what I also would like to thank is Graciela Latan and Bruce Garham, the librarian at Toronto Public Health, and Duncan Dixon, the librarian from Trinity Western University, for their invaluable assistance in searching all the thousands of articles and purchase all the book about knowledge translation and systematic review. I am sure they are very glad that I finally finished the project. Thank you very much. And question?
So, May, it's Catherine here at RNAO. I do want to thank you very much for the presentation. I think you've given us lots of strategies that are applicable both within community health and beyond. And to thank you also for this lovely photo of Toronto Public Health and with their DSO sign. So thank you for that. And again, yes, if anyone has questions for May, please either *6 to talk to her or use the chat box. Thanks.
The picture is actually half of my champions. We have a champion development forum every year annually, and this was in Toronto, a lovely, lovely place. And just they actually having in-service or having training together. But the best of this picture is that it was designed by the champion to the champion. So stakeholder ownership is important, is crucial. So I welcome for question right now. You can also, yes, the question is, did I use conceptual framework for this project? Yes, the two of them is the Joanna Briggs Institute Model, and also the knowledge KTI Model, the knowledge to action framework by Graham. Next question is, have you been successful in engaging other disciplines when implementing BPG? Yes. In public health, we have a plethora of other professions. And so we have nutritionists, we have health promotion consultants, we have social workers, we actually have nurses, we have a variety of interprofessional people that I engage them in implementing BPG. One that I have to say is our dental department. I actually involve them to actually implement the smoking cessation BPG, and they actually are the ones faithfully every quarter gave me the data. Oh, okay. To send your question to the participant. Okay. The next question is, in the community, how do I send it? Oh, okay. I'm going to send it to. So the next question is this one. In the community, we are often look at multiple chronic disease. Is there a strategy for us addressing more complex processes? From what I look at, chronic diseases, one of the article is a systematic review. He actually is implementing multiple strategies for the chronic diseases in primary health setting. The strategy that I mentioned, he did a systematic review, and the 21 articles that they had. It's a variety of the strategy that I mentioned. It's all in the article. It's all in this article to implement multiple complex process. Okay, let me find the articles. The articles is actually from Europe, and I'm going to give you the article's name. It's 2012. I'll just get the reference. Give you the article's name.
May, perhaps if you can't find that, then afterwards we can send it out via email.
Yeah, I probably could right now. The article's name is assessing the. I'll type it. It's called Assessing the Effectiveness of Strategies to Implement Clinical Guidelines for the Management of Chronic Disease at primary care level in EU member states, a systematic review. So you know what? I would actually email to Carl and sort of give it to you, the whole title, to implement clinical guidelines for the management of chronic disease at primary care level in EU member states. Systematic review. This is one of the systematic review that I include in my article. There you go. I should say that in the all. Okay, here it is. Here's the article name. Any other questions?
Yes.
Oh, there's a few. The next question is, do you implement other best practice guidelines other than RNAO BPG? No. My organization is the Best Practice Spotlight organization, and so at this time we're implementing the RNAO Best Practice Guideline. There's so many other clinical guidelines, and it's because of this systematic review that I undertake. I realize that there is a plethora of them, but we start with the RNAO first. How long did it take to complete your systematic review? Yes, and were you doing my master full-time? Yes, I'm doing my master full-time work. Yeah, and I took about a year and a half to complete my systematic review. Actually spent at least 1 year to actually doing the protocol. Most of the time spending on the protocol and the steps, but it took 1.5 years for 1.5 years for the systematic review. Usually a systematic review had a group of people doing it. Well, I'm the only one that's doing this review, so it takes a little bit longer. Okay. How can the nursing agency, this is another one, how can nursing agency get involved in the best practice to educate a healthcare worker in the community setting to provide the best quality of care to respective clients. You know what? I am going to suggest you to actually involve in best practice spotlight organization. I love to talk to you, talk to your organization about that. Join the wave, join the train. Best practice spotlight organization will really change your practice, change your agency practice. It changed ours. It changed our culture to be more evidence-based culture. And literature review, to be honest, is one of the steps that we usually take. We do not now at all saying, we want to implement this program. We want to check out, is there any guideline out there? What are the guidelines of doing this kind of program? Or is this program more effective? So I welcome you to join the train, the Best Practice Spotlight Organization train. And if you like, please talk to me. Next one is, are you hoping to have your thesis published? Yes. My professor and I are working on publishing this thesis in a journal in the future. I was going to let you know that actually signing up as a best practice spotlight organization, you need to write a really, really long proposal, and also it's like a 3-year process. So the next one won't be here until the 3 years from now. But what you can do is start looking at one best practice guideline and just look at them and see if you can implement this. Gather a group of people and talk to each other. One of my master colleagues is actually implementing or started the oral health BPG in Labrador, believe me, in Labrador, in the long-term care organization. So we all can do that. What is one strategy that you feel is the most effective is the next question. Well, my favorite strategy is still using the champions. As you see in the picture, this is all of them. The champion is from director, from the senior management, all the way to manager, all the way to frontline worker, to consultant. I love using this strategy. I think it is still one of the most powerful ways to engage stakeholder and let them own the process.
Hey, can you just speak more about how you use the words own the process? I love it. Can you say a little bit more about what that looks like at Toronto Public Health?
Sure. I would, if you see these champions in the picture, I am not the one that would design this whole champion development forum. I have a group of champions, and one of them always tell me, if you stand next to May, then you will become a champion. Just stand. That's what he did. He stand next to me one day, and I grabbed him. I said, would you like to join me for this best practice project? And I guess he said yes. And from then on, he became the champion. He actually became the smoking cessation champion. The person that is doing that is actually the one sitting in front of the poster. And the next thing he knows is he's learning how to do storytelling to spread the word to the champions. And the next one is actually developing the champion development forum every year that we have. So I have a group of champions. They're the one that decided what kind of training we will put on every year. So this year, last year we actually doing sustainability as a topic for the champion. They designed actually using a Jenga game for sustainability. And this year we're going to use our favorite logic model. We're going to talk to them. They're the one that designed it about evaluation. And we're going to use an interactive activity, the interactive activity training, to actually convey the message that evaluation is it's important as a champion, so champion needs to find evaluation in them. So the next question is, have you invited the long-term care stakeholder in the process? Not yet, but that could be one of the recommendations that I would give to my best practice steering committee. Thank you. That's a good idea. In Toronto, it's a little bit hard to invite long-term care stakeholders because we have a variety of them, but certainly it's a good one of the good strategies that we could try.
Are there any other questions for May? We have a few more minutes remaining.
I saw one of them saying that they use the best practice coordinator. It is really crucial to have one person full-time looking after, or not looking after, but spreading the word of the best practice guideline. Without this one person, it is very hard to coordinate, to support the initiative, and also actually to actually spread the word, to actually recruit champion, retain champion. It is really crucial for organization to have that one person. So this question is, how did you recruit, train best practice champions? Did you recruit once you had selected the BPG, or just trained so you had a group ready to implement any BPG? Number one is that we have a structure in our steering committee. We have 10 BPG, so we actually have 10 teams. Each team we have a manager lead and a team lead, which is a champion. And from then on, we actually, within the team, they recruit the champions. And they have their own BPG training for their own content. And then once a year, that's what you saw, is once a year, our whole group will get together to have a champion development forum, and that's trained by the champion. And at the start of the BPSO, we actually ask staff to apply as a champion. We actually have a form for them to sign. So what I did is that I actually went with my steering committee. We have about 11 offices. So each offices we went for one day to recruit champions. And actually I have made an evidence practice tree, and so I bring my tree for them to, it's an interactive exercise, so I actually ask them what evidence means, and and they tape it on the tree, and at that time I would actually give them a package of champion packages. And at the end of that first year, I remember at the end of all the recruitment, instead of, I remember I wrote down about 40 people I want, I have actually over 90 people, over 90 champions. With our first recruitment. So every year what we did last year is we actually recruit the champions from Nursing Week. I actually set up a display with champions to different locations during Nursing Week to recruit more champions.
Any other questions for May? We're almost out of time. Maybe time for one more question if someone would like. Well, I don't see any more, so again, on behalf of RNAO, May, I want to thank you very much for your presentation. again, for your passion and being, I would say, a capital C champion, and for all the great work that you're doing. We certainly wish you much success with getting the work that you've done on your master's published so that others can know about the work and your wisdom in the area of champions and implementation.